Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about the cardiac output. So let's get right into it. Here we're looking at a picture of the heart, a diagram of the heart during a systole. So it's during ventricular contraction. And what's happening here is as the ventricular contracts, the left ventricle is sending blood to the aorta, which then goes to the rest of the body. The right ventricle, of course, is sending the blood to the lungs so that it can get oxygenated, come back to the heart, and then be sent to the rest of the body. Now, we're going to talk about cardiac output today. And it's kind of exactly what it sounds like. Cardiac output is talking about the volume of blood that's being ejected from the ventricles every minute. So we're talking about the amount of blood that's being sent from the left ventricle to the rest of the body via the aorta. And also, we're talking about the amount of blood that's being sent from the right ventricle to the lungs. You expect those to be the same, or else that can lead to be some of the other problems. Right now, we're just going to try to look at how to calculate cardiac output. And it's a pretty simple formula. And it only involves two things that we've already looked at in previous episodes. Cardiac output is equal to SV, which is stroke volume, HR, which is the heart rate. Now, stroke volume tells you the amount of blood that's ejected with each beat. So we're talking about milliliters of blood per beat. And then with heart rate, we're talking about how many times the heart is beating in 1 minute. So we calculate it as beats per minute. So stroke volume is the amount of blood ejected from the ventricles, let's say the left ventricle each beat. And the heart rate tells us how many times the heart is beating, how many times the ventricles are contracting in 1 minute. Now, if we multiply this out, of course, if you apply some simple algebra, we're going to be canceling out the beats. So cardiac output is calculated in milliliters per minute. Now let's plug in some values. The average adult male has stroke volume of approximately 7. Stroke volume of 70 milliliters per minute. And the average heart rate of 75 beats per minute. Now, if you want to calculate the cardiac output, the amount of blood ejected from the ventricle each minute, the cardiac output would be equal to 70 milliliters per beat times 75 beats per minute, and that's going to give us a value of 5,250 milliliters per minute. Or of course, you can make that as 5.25 liters per minute. So this is the average adult male at rest, 5.25 liters per minute. Cardiac output. Now keep in mind that the average adult male has about 5 liters of blood in their body. So every minute, the heart is recirculating pretty much all of the blood if you're just at rest at all. So the heart is doing a significant amount of work. It's sending the blood to the muscles, that the organs that need to get oxygens and nutrients that come via the blood. Now, if we want to change cardiac output, or if you want to influence cardiac output, it should be obvious that we can do that in 3 ways. By influencing stroke volume, by influencing heart rate, or by influencing both of them. So if you make a change to the stroke volume or their heart rate, that of course in turn is going to make a change to the cardiac output. Now, when you're exercising, you're going to have a little bit of different situation. You know, when you're starting to exercise and you're doing some aerobic activity, your heart rate is going to increase. Your cardiac output is also increasing because you're increasing stroke volume and your heart rate. So that's going to give you some different values. Now let's take an example where we're trying to calculate cardiac output again. And as usual, cardiac output is equals to stroke volume. And we're going to take that and multiply that by heart rate. We're going to say that during moderate exercise, stroke volume might increase to a point of, let's say, about 100 milliliters per beat. and let's say the heart rate increases. Before it was 75, and let's say let's go with 100 beats per minute. So we have more of an intense situation. It's not a very stressful situation, but you're doing some modeling exercise. In other words, your blood is being pumped through your body twice in that minute with a moderate exercise. Now, as you exercise and you train, hopefully, we're doing this on a regular basis. Hopefully like 3 times a week. But as you're doing this more regularly, there are going to be some adaptations that are having. One of the main adaptations is that your stroke volume increases. Your stroke volume increases, in other words, every time your heart pumps, it pumps more blood than the average untrained individual. And then what that can do in turn is that can actually cause a lower resting heart rate. Alright, so a trained person on average has a lower heart rate than an untrained person. However, they're still able to get the same cardiac output. In other words, your heart is becoming more efficient at pumping the blood every time it contracts the ventricles. It's sending a significant amount more than the untrained person. And you can achieve the same effect with not even a better effect with less work.